you're seeing your hands are clean, okay? The most important thing with open gloving, that as a couple of you have walked around I've noticed, which is why I'm demoing it, is that you touch nothing but the edges of the packaging, okay? So far too often I see a lot of, and that's a major risk, because although you're not touching the middle, as soon as you pick your glove up and your glove does that, that's an undetected sterility break by you guys, because you won't have thought about it. We used to get students to do this with the Glitterbug soap. Have any of you seen the Glitterbug soap? It's this really cool soap that basically has got hidden glitter on it. And if you touch anything afterwards, you can't quite see it, but if you shine a UV light, you can see where they've touched. So it's a great thing for checking how you clean your hands accurately with who, and also for touching things. So once you've opened it, you want to use just the edges, and you just want to give them a little pull, and that's what stops the paper from folding in. You don't want to over flatten it. You just want to pull your corners like that, and then it will sit. And now this very edge is not safe, but actually everything in here is safe. Okay, and then choose to go however you want to go, left or right, whatever works for you. I tend to go left, so I actually glove my weakest hand first. At this point, I like to make a bit of space. Rub my hands, and these are my tips, okay? So I loosen the material up so that it's ready to be able to receive my fingers, and I've like kind of got it a bit ready rather than trying to squeeze my hand in and then stopping. And I also get quite far through with my fingers, because if you hold that and push through, you push all your fingers through. The advantage of this is that if I take that back off, you're not trying to touch your other glove with loads of flappy fingers that feels really hard. So all you've got to do is keep a hold of it. Just keep a hold of that corner. And if your gloves fit you well, I mean, this is a large, and look how well that's gone on my tiny hands. You should be able to have the space to then just sit like this, and that's quite ready to go. All right? Use your fingers there to secure that. I pull that tab up a bit. And then at this point, I tend to come away from the table. I don't stay doing it here. Partially because I want to keep this area sterile, and also because I really risk my breaking asepsis there of touching any of this edge, all right? So I tend to come away and have my glove completely ready so I can then put my other hand in. And I do the same thing. I give it a little lubrication, little move around. That's all safe to touch anything. That's not going to touch my hand. It could, but it's not going to as long as you hold it correctly. And then straight over. And again, it's all about, that looks really easy, but it's all about keeping that hook till my fingers are in till the last minute. Okay, and if I'm there and I'm still faffing, sometimes I'll just faff for a little bit and pull it through more. The benefit is to go bigger, FYI. The bigger you go, the easier it will be. Then come under, make it really clear that you are pulling away from your wrist. Don't do it close, because doing it close risks the breaking asepsis that your examiner catches that you guys don't catch because you think you've done it well, and then you can hook your thumb, and then you're done. Okay, so, and take your time. That was probably 30 seconds if best. You can do it quicker, you can do it in 10, but most of you have gone round and we've said you've actually got loads of time on this task. So why risk breaking sterility on what should be an extremely easy task that you should be able to walk into and go, yeah, I know how to do that. And nerves, go bigger on your sizes. Don't go for your size, don't even go a size up, go 2 sizes up, okay?